Welcome to 6th grade health. I just noticed something else that I did. All right, I did that to the 4th graders only. I still had history up there from your class video, and I paused it and I redid the board. Okay, so this is for lessons 135 and 136, 6th grade health, pages 39 to 47. There's a quick check on page 41 and 46 that I'll have you do on paper. You could do that on the same paper. When you get to 47, you're going to stop at a deadly bite. There's also a health worksheet number 2 that you're going to do. So you should have all of that. And we're going to go ahead and jump in and talk about some things. We talked about the hot weather, things that could happen in hot weather that would cause some concern, heat exhaustion, muscle cramps from exercising or from being out in the heat and being dehydrated, and muscle cramps come from that. Sunburns and skin cancer and how we deal with those things. There's heat stroke, which is very serious, it's life-threatening. And so those things that we need to watch out for. There's some cold weather crisis things that we need to watch out for as well. If you are out in the elements, out in the snow or in freezing weather for a long period of time, and you don't have warm enough clothing, or even if you did have warm enough clothing but something gets wet because you've been playing in the snow or something, or if it's just really extremely cold, you are susceptible to having to getting these couple of these things. And frostbite would be the first symptom, and that's where you can't really feel your extremities or part of you. Fingers and toes are the most common to get that first. The freezing of the body tissue, it's numb and discolored skin, and that should be treated as soon as possible. But you want to warm up slowly and not too quickly. If possible, though, you should immerse it in like your hand or your foot or whatever part in warm, not hot water, just warm water until they regain the normal color. Okay, and that's how we deal with that. You're not supposed to rub or massage the frostbitten area. You can actually cause some damage, so don't do that. It can cause gangrene, which is the decay of body tissue, and that is how you actually lose like fingers and toes and things, and we don't want that. So these things help us prevent further problems by following these simple instructions. Don't rub on it, don't massage it. Now, if it hasn't discolored yet, it is normal to rub your hands together to get them warm and stuff. As long as they're still the right color, you can do that. But if they started being numb and are starting to turn colors, don't do that. Just get inside, get them in some warm water, and take care of it that way. Hypothermia occurs when your body temperature drops below normal. So it can be first suspected when someone starts shivering and their teeth start chattering. They might get dizzy, lightheaded, and difficulty moving, stiffness in their muscles. If they don't have any help right away, or if they don't get treatment, their speech can slur, they get a slow pulse, they start losing like memory, like short-term memory. They don't know what's happening because their body is just so cold and it's shutting down. So if the victim is not treated by this point, they can become unconscious, and then eventually they will die from this. It is a serious thing, and so you want to make sure that you get them inside. If they have wet clothing on, you want to replace that with warm, dry clothing as soon as possible. The temperature should start to rise with dry clothing next to their skin. You want to cover with blankets, towels, place them near a heater, fireplace. You may want to give like warm liquids to them. And so just some things that you can do that would help help them recover from this, and that's the goal. And so there's that quick check that you can answer, and we'll move on to talking about critical conditions, calling 911. Before you begin any first aid on someone that is in a life-threatening condition, you should call 911 or someone else have them call for you. But before you perform any first aid, you need to be trained in that. So there are some things that we've talked about that you can do. Applying the cloth to someone's nosebleed, you can do that. You can instruct them in how to hold their nose, where to sit and stuff, those sorts of things. But things like giving CPR, or giving, doing the rescue breathing, or there's other things. You really should have some training. You want to be prepared for that, because if you do something wrong, you could cause a lot more problems for the person. Now, if there is if there is blood, you want to put a clean cloth on that, and if the blood soaks through the cloth, don't remove that, just cover it with another cloth. That saves from having to be moving stuff, and just as added pressure on that to help it. And so then you continue to apply pressure for 7 to 10 minutes. You want to elevate the injury if it's possible, and once it's, and that's above your heart, there are some pressure points that you could know that would help reduce the flow of blood to that injury. So if you knew, there's brachial arteries, which are in your upper arm. And so you see the picture there of the girl holding the pressure point right here, and she's applying direct pressure to this injury, and it's elevated above his head. Okay, so those three things, she can hold the pressure point with the one hand and apply direct pressure with the other. And this is also holding the elevation. So you see that she can do it with two hands, and so that helps. There's the femoral artery. So if there's an injury to like the lower leg or the foot, the femoral artery, think a femur, as we've been learning, or as you've learned in the past, your femur is that upper bone in your leg, and the femoral artery is in the upper leg. And there's also the radial arteries, and so that's actually your wrist. So if there's something in the hand, say they cut their finger and it's a really bad cut, if you can put some pressure right here, it would help for that blood flow. The carotid artery is the neck. So if there is a head wound, they've hit their head on something and they're bleeding, so you can hold the carotid artery. Just be careful with that one. You don't want to hold it too long or too close to the throat. You'll cut off their breathing. The temporal artery is the one that's on your forehead. So I guess if there was a forehead one, an injury here, you probably want to just do the one in the forehead. There's concussion that you could get. Now you have, and then actually these three are for finding your pulse actually. So scratch that. These ones are for checking your pulse, to see if the person is has a heartbeat. And so the easiest one for that is actually this one. And if you hold it there for a few seconds and you're completely quiet, you'll be able to feel it. And so we do that with 2 fingers. If someone has been hit in the head injuries can cause, you could have a scalp injury where it's like a scalp wound, or like that's the outer wound, or you can have a brain injury where it's actually inside. And you guys know that Miss Hecker got one, and so that was from getting hit, and then her head hit the window, and so really it was the window that really caused the concussion there. But the concussion is actually an injury to the brain. It's where the brain is actually been jostled inside the bone, the skull. Okay, and a contusion is an even more serious head injury that can result, and that's multiple bruises to the brain. And so those take long time to heal, months to heal from. There is, if somebody has lost their, someone can't breathe, so they've been, they were in a pool or something, and they're full of water, they can't breathe. Could have happened from an electric shock, or heart failure, or poisoning, or suffocation, blocked airway. There is rescue breathing, or artificial respiration, that helps the victim breathe on their own. And there are there's like a mask that you can get for some first aid kits that would go over their nose and their mouth, and then you breathe in, but it doesn't let the air come back out into your mouth. And so that's one way. Anytime someone is not breathing, you need to call 911 immediately. And there are, then you should provide an open airway as soon as possible. So you want to tilt their head, place them on their back, and tilt their head back by placing the heel of one of your hands on the forehead, and lifting the chin with your fingers. And then you want to open their mouth. And if you can see something in there, like say they swallowed something and it's really big, you want to see if you can dislodge it some way, or if it's a little kid and they swallow, or they get a marble stuck, and maybe you can see the marble. You might be able to dislodge that, but you want to make sure that you can help them. Now, if the person is choking and they're actually coughing, let them cough, because a lot of times your body will help you force it out. And so don't try to stop someone from coughing. But if they are choking, you ask them, are you choking? And they would nod their head yes if they're not able to talk. And sometimes if they're a victim of a heart attack, it says that they will have similar symptoms, but they will be able to talk. But a choking victim, you want to use a procedure for that. It's called the abdominal thrust. It's also known as the Heimlich maneuver, but it's where you stand behind them and put a fist with your thumb, like in your thumb right there, and put your fist in their stomach and your hand over it, and you pull up, okay? And it's sharp upward and inward jabs until the until it comes out. This is the universal sign for choking. So know that if someone is doing this, they really are choking, okay? Like if they can't talk and they are choking, this is the universal sign for choking, because you can't always talk. You can't always cough. And so you want to make sure that you are paying attention to people. Now, one of the last things is poison. If someone has been poisoned or ingested something, maybe there's some poison that gets on the skin and it starts causing problems. You should know or have access to the poison control number. They are ones to contact, and they will ask questions. If you think someone has like a younger sibling has maybe drank some Lysol or something else, if whatever might be in your house, you should take that object with you to your phone call, okay? And then you say, okay, I think they took this, and this is what it says on the back. And they're going to let you know what needs to happen with that, and they're going to get the help that you need. And so there's some signs with the poison: shortness of breath, convulsing can happen, and so it really can be dangerous. But you want to make sure you get instructions from an authority before administering any treatment, and that's one of the things that talking to someone from poison control can help you with, because they would know what you need to give them if you have it, and if not, who to contact to get that. So that quick check on page 46 is a true or false, so you're going to answer that one, as well as the one back on page 41. Don't forget the health worksheet number 2, and go back and read these pages up to 47, stopping at a deadly bite, just under poison, okay? And we will talk with you next time.